behalf of my organization, Temos International, I would like to kindly address sincere thanks to Saudi German Health for this kind and honoring invitation. So today I'm going to stress out the importance of quality standards and international accreditation in medical tourism. After all these fascinating pictures for these 8 segments of health tourism, we need to realize that the common element behind is the trustful healthcare system, the healthcare services which can be trusted and which are reliable for the medical tourist, but also for the regular tourist, right? So, the fundamental conclusions after 10, 15 years for medical tourism business is that medical tourism destinations have high quality services, prompt treatment availability, which means no delays for the medical tourists, and competitive prices. And at the same time, there must be a way to ensure a positive patient experience. In quality assurance, now we're discussing about the patient experience and the patient-reported outcomes more than what we used to discuss about patient satisfaction. So we will see that throughout the medical care cycle, the patient experience in this journey is very significant, very important. So, although these 3 conclusions might sound very simple, they have behind a prerequisite, the development of a national strategy for medical tourism. So, for medical tourism destination, we need to ensure that all these qualities are built up by the time. And first of all, it's the public and private investments in healthcare facilities, along with the touristic facilities and the hospitality infrastructure. So medical tourism is a VIP service, and the medical tourist has to be treated and handled as a VIP person. At the same time, there are organized strategies for quality and patient safety assurance. So patient safety is a very important matter. I don't know if you have noticed, but since 2017, WHO, OECD continuously publish reports on patient safety. And patient-related adverse events and safety-related risks are considered as the major hazard and the major threat for the sustainability of health systems nowadays. So another element is the centers of medical excellence expertise. So throughout the country, we should establish well-known medical facilities with high expertise and with proven evidence-based clinical outcomes. Clinical outcomes are those who drive the medical tourists to our country and to our healthcare facility. Another thing is, of course, international networking. I'm not going into this part so much. This is about marketing. This is about establishing a network with allied parties. Another very important part is the highly qualified staff. It was already mentioned by Dr. Fauzi, and accredited medical professionals according to international standards, and of course investment in continuous education for the healthcare workforce. So, medical tourism is a complicated service and has many different elements. And for all these elements and different functions, there should be standardized procedures established. There should be quality criteria to be considered. From the moment that the patient is still at his home country, where very significant decisions have to be made. So the selection of the medical tourism country, the destination country, the selection of the medical provider, the exchange of medical data for the treatment plan to be organized and arranged, the preparation, the physical preparation of the patient for the travel and for the on-site treatment, the pre-traveling arrangements and all the logistics that should take place. Then upon admission, we have the admission and screening procedures, and imagine how crucial this has been during the pandemic, the screening procedures depending on the origin of the patient and the specific characteristics of the patient. So the treatment itself, it should be organized according to international standards of practice. This is very important to prevent adverse events and complications. And at the same time, invoicing functions, the discharge preparation, the fit-to-travel preparation. And in order to have the continuity of care and the optimum outcome for the patient, we need to have a pre-arranged follow-up process. We need to take care about the appropriate orders for the patient to be well recovered at his home country when he's returning back, and to have, of course, the rehabilitation treatment and the follow-ups and everything else that might be needed. So throughout this process that I have been describing to you, there are various risks. And the scope, the goal, is to mitigate those risks. So whenever you're hearing about the accreditation service and certification compliance assessment, all these aim to one single thing, to mitigate the risks. Not only for medical tourists, but for any patient, for every single patient that is treated in the frame of a healthcare system. So through the accreditations, we aim to protect the patient, and we aim to safely, let's say, handle all the special elements of treatment, of the treatment for the medical tourists and those patients which are involved and engaged in cross-border care. And this is not something that has been, let's say, pointed out in the frame of national strategies. Lots of medical tourism facilitators, mediators, and payers of the services pay significant attention to quality standards, and health insurance organizations are strongly demanding accreditation programs to be well established. Excuse me. And of course, these standards are appropriate in order to, let's say, provide evidence for a trustful outcome to the clinical practice. So, in a nutshell, major elements that we should consider. First of all, the qualitative and safe services approach throughout the medical tourism care cycle, the patient expectations, which should be somehow handled, and especially in medical tourism, we need to think about the individual perceptions, which are depending on cultural background, on the social background, on the previous experience of the patients. And of course, at the same time, we have involvement of different stakeholders, which should be somehow well coordinated. So the accreditation is a neutral, objective process for the assessment and evaluation of compliance of clinical and non-clinical services against compliance, quality, and safety criteria. So, a short introduction on Temos. Unfortunately, this is not so easy to handle. Okay, so Temos International is a German-based accreditation body. We have been working across the world for over 12 years. We are present in more than 18 countries, and Temos provides accreditation according to ISQA, IEA accredited standards. So our standards are acknowledged, and there is a specific competitive advantage of Temos. We were the first and unique accreditation body that have been focusing on international patients management. So we have a very specific part in the frame of our standards, which is about medical tourism and the essential qualitative criteria that should be established. So we have a big network and allied partners. We have recognition from different well-known organizations. One of them is the Diplomatic Council, which is a UN-registered organization. And Diplomatic Council acknowledges Temos International and provides a certificate, the Diplomatic Council Preferred Partner Hospital, to all the Temos accredited partners. So last but not least, I wouldn't like to miss referring to this exceptional cooperation which has been recently established, the cooperation of Temos International with GAHAR, the Egyptian National Accreditation Body. The agreement was officially signed on the 4th of April. And of course, the aim is to additionally qualify the Egyptian hospitals with all these elements of quality and safety for medical tourism. And of course, the prerequisite is at the first level, the GAHAR accreditation, and on top, healthcare providers will be assessed for the compliance against the Temos Excellence in Medical Tourism standards. So we are here, we're talking out of our experience. We love to be on site in the frame of the healthcare providers' settings and to, let's say, show the way to a safer care and to optimum clinical outcomes for the patients. I'm very happy to be here and I will be very pleased to answer to your questions. Thank you very much for your attention. Thank you very much for being here today.